Hello and welcome to the STS Advocacy Legislative Fly-In in Washington, D.C. My name is Vinay Badwar. I'm a cardiac surgeon in Morgantown, West Virginia, and serve as the STS Council Chair for Quality, Research, and Patient Safety over the STS databases. I'd like to discuss with you today access to claims data as part of your briefing prior to your meetings today. The overall ask is for Congress to guarantee clinical-led, clinical data registry access to government claims data. There's been bureaucratic red tape that has made it nearly impossible for registries to access claims data. And I'll review some of the talking points and the issues at hand. First, let's go over some terminology. The term registry is short for clinical-led data registry. For example, of course, the STS National Database. Access to claims data refers to access to Medicare, Medicaid, and state children's health insurance program claims data. Now, for some background on your own registry, the STS National Database, the database was established in 1989 as an initiative for quality assessment, quality improvement, and patient safety among CT surgeons, containing decades now of clinical outcomes data. The database has four components: the STS Adult Cardiac Surgery Database, the STS General Thoracic Surgery Database, the STS Congenital Heart Surgery Database, and the STS Intermax Database, as well as access to the STS ACC TVT Registry. Our database houses over 8 million surgical records and currently has more than 5,000 participating physicians, including surgeons and anesthesiologists, representing well over 90% of all cardiothoracic surgery performed in the United States. For registries, longitudinal analysis is one of the most valuable research tools for measuring quality improvement. Without access to claims data, longitudinal analyses for significant portions of the population is challenging, if not impossible. The outcome-based research can lead to improved and more appropriate CMS payment policies. It could help align Medicare reimbursement models with real-world outcomes in a meaningful way, and it could ensure that Medicare value-based payment models appropriately consider the health outcomes of historically underrepresented patient communities. Longitudinal research involves tracking patients over time and across different providers, as most patients receive care in several different settings and not necessarily return to the same provider or the same care setting for follow-up. Registries need timely, cost-effective, and continuous access to Medicare claims data to perform these types of longitudinal analyses. STS and many other medical associations have attempted to go through current bureaucratic pathways to secure access to claims data. However, these have often fallen short. In addition to being slow, cumbersome, and expensive, the pathways do not currently provide sufficient access to Medicare claims data for quality improvement purposes, and that is what we are here to discuss. Now, when it comes to barriers to access, there are quality improvement issues and there are research issues. As you have these items listed here, the policymakers have understood the critical role Medicare claims data can play in understanding health care and designed programs such as the HRQ and other elements to attempt to do some research issues. However, the data accessed for quality improvement cannot be used properly for research or quality improvement in the most effective manner. The STS ACC TVT registry was even barred from accessing Medicare claims data to share with medical device industry partners to help them meet their FDA post-market surveillance obligations. And so STS wanted to access claims data to help in the design of a new payment model that would both improve patient care and, importantly, save the Medicare program money, but we couldn't determine a path forward. Now, legislation potentially could change that, but one thing I want to make sure you all are aware is that value is cost over quality. So if we can access claims data and match that with the robust nature in the STS database in a formidable way, we could then show the value of what we do for our patients every day. And that's how you can help represent this issue in your visit today. So this brings us to our primary ask. Representative Larry Bucshon, a cardiothoracic surgeon himself, and Representative Kim Schreier, who's a pediatrician, have introduced a bill that would make sure we can access the claims data we need. We owe them a debt of gratitude. Please ask your member of Congress in the House to co-sponsor H.R. 5394, listed here, or in other words, the Meaningful Access to Federal Health Plan Claims Data Act of 2021. These pieces of legislation would help provide clinician-led clinical data registries with access to Medicare, Medicaid, and state children's health insurance program claims data, and preserve Medicare coverage with evidence development. In Senate meetings, please ask your senators to make sure that healthcare legislation that passes this year includes critical provisions on access to claims data. We have no reason to expect that the House of Representatives is poised to include H.R. 5394 in an end-of-year package, and will need to ensure support from the Senate as well. Likely this will be included in the Century Cures Act 2.0, and we hope to move that issue forward. Remember, when you're meeting with your senators and House representatives, put this in your own words, or as Representative Kim Schreier said on our recent advocacy webinar, tell your story. This is what they want to hear. How these issues are important to you personally, to your practice, and to your own patients. They take that information along with the data that we present to committee meetings to help institute these changes. So hopefully you've understood now the issues with access to claims data, and you can apply that to your own practice, and good luck today.